Mary Ugolini here with Rebel News, and as Canada's National Immunization Advisor has come out publicly promoting fall 2023 COVID-19 boosters, which lists pregnant women as high risk. A group of health professionals have launched a campaign to provide balanced medical information and research to this Canadian demographic. The campaign is called Protect Pregnancy. First, do no harm. And the Canadian COVID Care Alliance has teamed up with the Mama Bears Project to launch this presentation that features the most up-to-date, peer-reviewed scientific research, chock full of educational resources. Joining me now to discuss this campaign is retired physician Delinda, who details her background before getting into the campaign here. Have a listen.
Actually am a physician. I have my boards in internal medicine and then did anesthesia for 20 years and moved to Canada and became a Canadian citizen. So I'm American Canadian. My health fell apart essentially. And, I know mainstream medicine and conventional medicine. And I actually had to find my own ways of healing and reach out and learn integrative medicine. So I actually did a fellowship in integrative medicine and went back to the US and practiced until 2019, at which point I retired from integrative medicine and I moved back to Canada to actually complete a master's in spiritual care and psychotherapy, which I did in 2021. A number of us were very concerned about how COVID was being managed and what was coming about. Before I retired in integrative medicine, I actually would treat long haulers from viruses, and I would also treat. We knew how to treat viruses, so this was not something we didn't have the tools for, and it was very surprising the way the public health messaging just cut off all other options other than you wait till you're on death's door and then you wait for a vaccine.
Most recently, as we see our national vaccine pushers, NACI, the National Immunization Center, giving out recommendations into the fall of 2023 for a COVID-19 vaccine strategy that appears to prioritize logistics over actual science. So given this new information and this new recommendation, why has the CCCA launched this campaign?
Well, throughout our short history, we've been just aware of how we've been shunned and shamed for asking questions and expressing our concerns. Women, pregnant women especially, are being targeted are being targeted to increase the number of vaccinations and the including mRNA products during pregnancy. There is behavioral engineering that is going on, which is sort of a more sophisticated way to influence our thoughts and behaviors. And there is, as you mentioned, there is a real pressure in campaigns, marketing campaigns, subtle or not, that are targeting pregnant women. And we feel that pregnancy is something, and reproductive health and breastfeeding, all of the reproductive continuum needs to be protected from predatory forces.
But if we look at those historical contexts, right away it comes to mind the thalidomide crisis. And I know that there were probably more. Perhaps you can enlighten us on what other historical instances there were where future generations were harmed by big pharma products.
Yes, absolutely. In the 1960s, 1970s, I believe the drug diethylstilbestrol, also known as DES, was actually marketed as a wonder drug that would help prevent miscarriages and early labor or preterm labor. And they were pushing to give it to all women, all pregnant women. And it turned out that even though problems weren't seen immediately at birth, what they discovered was that there was definitely an association between giving DES to pregnant mothers and to their offspring in terms of reproductive abnormalities, reproductive cancers, and these often didn't show up until the children were reaching adolescence. There's no question that the substances that we expose our babies to while we're pregnant can have effects on them that aren't immediately seen. And so given that that pregnant women are being really targeted by this whole vaccination campaign and COVID shots, we really, really felt like, pregnant women, expectant parents need to have the resources and information available to them so that their questions can be honestly and genuinely addressed and their concerns can be taken seriously and they can make good decisions for themselves.
What does the data show, and is there any evidence to support the justification that pregnant women need to be lining up on this conveyor belt of endless boosters?
Yeah, today's pregnant women are not at high risk for severe disease from COVID. The early studies that were done that were used to justify pushing this product to pregnant women and basically used to scare them, they had an incomplete database, and it was actually from the epicenter of COVID, and had the severe outcomes were typically in women that had other pre-existing conditions that would make them more susceptible to severe disease. But when you look at the studies that have included a much larger database, that have looked at all pregnant women and all the pregnancy situations of people in the ICU, there really is no difference in pregnancy outcome for women that have COVID. In fact, a number of women that were actually tested, a number of people that were tested for COVID, because they tested everyone that came in, so they had a more complete database. There were a number of people that had that were asymptomatic for COVID, but had evidence of the virus. So, and they were asymptomatic. And those that did have COVID, they tended to do okay. The goal is to actually make people aware, especially young people of childbearing age and pregnant women, to make them aware, make Canadians aware that they're being targeted by pharma for these products, and that they really, the stories that they are, the science that they are being quoted does not necessarily represent what the research evidence is showing. Medications need to be proven safe, and mRNA products have not been proven safe for pregnancy. The only one RCT that I know of that was done in pregnant women was completed a year ago and was underpowered, and the data is not available to the public. So there have not been any RCTs that have proven the mRNA products safe in pregnancy.
Just to interrupt, Delinda, I apologize, but for anybody who's not familiar,
Sure.
RCT stands for a randomized control trial.
Randomized control RCTs, randomized control trials, are the gold standard for determining or proving safety. You minimize all the variables and you prove that a product is safe. And this has not been done for pregnant women for these mRNA products.
especially over that long term. Like we're talking, as you mentioned, the DES babies, it took
Oh,
20,
yes,
30
yes.
years postpartum, post birth, to realize that there was fertility impairment that took place. So obviously, this has never happened. We're only 2 years in. Pfizer's own data showed concerning trends of spontaneous abortion and fetal death. This is very concerning for pregnant women, as you mentioned, that they're being targeted by pharma. So, how can Canadians get involved, and where can they go to learn more on this subject and do some of this research, perhaps on their own, or connect with others who can help work them through that process?
So, CanadianCOVIDCareAlliance.org is launching a campaign protecting pregnancy and breastfeeding. Do no harm. It has it is a resource guide that is extensively referenced, and it is actually outlined in terms of questions that lay people or professionals may have. Healthcare professionals, too, we want to have them aware of this stuff. And it actually goes through, in fairly understandable terms, the various questions that come up, and that what you should consider, what questions you should ask if you have concerns about your health and pregnancy.
Overall, the aim of the presentation, which will be released publicly this Thursday, July 27th, is to learn from the historical mistakes that Delinda touched on while applying comprehensive evidentiary review and ethical standards to prepare expectant and breastfeeding mothers with the tools they need to gain informed consent before they inject one of these novel mRNA products. Products that do not have well-established long-term safety nor efficacy according to the gold standard of research, which is in randomized, placebo-controlled clinical trials. For Rebel News, I'm Tamara Ugolini. The censorship of medical professionals giving an alternative view will be further driven home by the Justin Trudeau Liberals' social media censorship plans. We've already seen some of it come to fruition through Bill C-11 and C-18. So if you would like to know what Rebel News is doing about it, then you can head on over to our special website at stopthecensorship.ca. There you can sign our petition calling on the government to drop its censorship plans and find out what we are doing legally about Bill C-11 specifically. That's stopthecensorship.ca.